Well, Dr. Mesut Yilmaz joins us now. He's a professor of infectious diseases and clinical microbiology at Istanbul Medipol University. Thanks so much for joining us again. You know, one of the areas where we've been hearing the most concern from people in the United States and elsewhere is an actual lack of accessible testing. You know, in the U.S. in particular, they're discovering, tests either aren't available or are very expensive. Is that a serious obstacle in fighting this virus?
Well, obviously in many countries it is. I would say Turkey does not really have that issue because we have manufactured our own national testing system and test kits, and they're widely available, and they're also being dispensed to other countries around. So testing is not an issue for a country yet.
Okay, but in countries like the United States, I mean, is that going to cause problems? People are trying to find out if they're infected and they're not able to get tested.
Definitely. We have experienced this with China. They were able to test approximately 2,000 people per day. That's why they have reported 2,000 patients per day during January and February, when the outbreak was really hot. And of course, testing capability is a great issue, particularly if it's expensive and not widely available.
Okay, I mean, I want to put this question to you. I'm getting an array of opinions on this issue, but knowing how disproportionately this illness affects people over 70 or people with already compromised immune systems, would it not be possible just to quarantine those most vulnerable and not have to put entire economies on hold?
Yeah, of course, that's a very good idea, but we need to look at how this would affect people socially. I mean, just isolate the elderly and the ones with comorbid diseases, and not isolate the others. Well, the others that are not isolated would carry the disease elsewhere and would spread. So socially, that is not really practical.
Okay, but I feel like people aren't thinking so much in social terms. These are rather desperate times now, and the measures being taken are desperate. So maybe that could be an alternative to consider. But let me ask you this. I mean, the government in China's Hubei province says now only the city of Wuhan qualifies for a high epidemic risk. All the other cities have now been reclassified as either low or medium. If the authorities, do you think, are to be believed, then is the worst really over in the worst hit cities?
I don't believe so. I mean, from what it seems, actually, as soon as the quarantine in the Wuhan region is done, is terminated, I believe we will see another huge increase in the number of cases, and this will not be over for at least a couple more months.
Okay. Dr. Mesut Yilmaz, thank you so much for joining us. We greatly appreciate it.